Hello and welcome to the Birth Untethered podcast. I'm Shellie, a long-time doula, advocate and former university lecturer.
And I'm Kemi, a badass birth keeper, formerly a UK registered midwife.
Just a couple of rebels with decades of combined experience in pregnancy, birth and beyond getting together to share wisdom. We exist to equip birth workers, families and seekers of truth with informed choice, not fear. Come as you are, learn what they don't teach. This is the birth revolution and you're all invited. Hello everyone, and welcome to Birth Untethered, Season 2, Episode 14.
Yeah.
I'm going to pause for a second here, and I just thought I'd invite people, please do get in touch with us if the podcast has helped you on your pregnancy journey or helped you to support a client, because we really love to hear from you. I think maybe in the future I'm going to share some of those stories if people are happy for us to share.
Many.
Maybe you can even come on the podcast, which would be really wonderful.
Yes, that'll be our Season 3.
Be so nice. Today we're talking about sweeps.
Sweeps! Oh, you're gonna trigger some obstetric nurses. You know they hate that broom. I love it.
I thought I'd bring it in.
Oh, I'm gonna love this episode, even though I hate sweeps with such a passion. It's gonna be fun.
So they're sometimes called a stretch and sweep, and those of you that have been listening to us up to now are going to be pretty clear about our thoughts on sweeps and whether they should be part of routine care or not. Kemi, should they be part of routine care?
That's my answer. You need to be watching us.
For those of you listening, Kemi was gesticulating with not just one, but both of her middle fingers.
Yeah, bilateral middle fingers.
Bilateral. I like that. The combination of medical terminology alongside an insult. That's good. Healthcare practitioners seem to like to promote sweeps as if this invasive procedure sits in the grey area between natural onset and medical induction. But let's be really clear, it doesn't. There is not anything natural about it. It is a mechanical form of induction that is not very effective at starting labour, but it is cheap and it's relatively easy to teach someone how to inflame somebody's cervix. So there you go. That's why it's massively used. And I think if more people realised that your cervix is the lower part of your uterus, that they poke their fingers inside your vagina, inside your uterus, and then try to inflame the bottom part of your uterus, which is the organ that is supposed to be holding your baby and keeping them in safe. It is a very invasive procedure. And I wish more people sort of realise that, because I think people don't realise it. I think often people think that someone's just going to do that round the outside of their vagina. I don't think they realise that fingers go right up inside and then through the cervix into the uterus. And what we have is that the prevalent attitude in research and in the narrative of the obstetric overlords are that women's experiences of procedures doesn't really matter. It's cheap. And it occasionally means that women may then not be forced into another form of induction. So in their thinking, it just goes, why not? Blanket offer it, in inverted commas, to everyone. And so they do. And we all know that offers from the vast majority of medical professionals means that they keep escalating that offer, in inverted commas, until you comply. It's escalated coercion. And Birthrights have just released a coercion in maternity document, which I can link in the show notes. But the rates of coercion in maternity care, the lack of informed consent, is hugely concerning. I mean, I know it's happening, obviously, because I see it day in, day out. But to see it in black and white, or actually in full colour, it was full colour in that document, it really was quite shocking, harrowing, honestly. And it really gets me, probably because I've seen it firsthand hundreds of times over and over and over. Honestly, I feel a bit like a sensitized cervix that's been poked and prodded too many times,
Yeah,
you know?
yeah,
And I want to, there's something I want to say directly to the midwives here who feel hurt or attacked when poor practice is called out by me or other people, be that on the internet or in documents or in research or whatever. I understand your reaction. I really hope that no one comes into this profession to harm women. There are some who are doing exceptional work under immense pressure. But here's the uncomfortable truth. When women are describing coercion, lack of consent, or feeling afraid in maternity care, and those accounts that we are sharing online or are highlighting, trying to highlight in a almost in a comedic way to try and soften the blow of the coercion and assault that is actually happening, which is what I'm trying to do. All of these accounts, all of the comments of women are backed by work like the recent report by Birthrights. And it's important that the conversation should not be and cannot centre midwives' feelings. Because it isn't about whether it's all midwives, it's about whether it's still happening to one woman. And even if it's one woman, that's too many. And it is still happening. And it is far too many. It is on a massive scale. Saying not all midwives doesn't reassure the woman who didn't consent to a vaginal examination. It doesn't undo the sweep that was framed as routine rather than optional. It doesn't help the many women who felt they couldn't or didn't even know that they could say no. If you know that that is not the way that you practice, if you are truly committed to consent, to autonomy, to respectful care, then the existence of poor practice and the calling out of that existence shouldn't feel like a personal attack. It should feel like something worth standing up against in solidarity. Because the people damaging trust in midwifery are not those of us who are highlighting these issues, like me on the internet with a few wigs. It is the ongoing and widespread behaviours that women are still experiencing every day at the hands of midwives and other medical professionals. There's something deeper here about validation as well. If your sense of being a good midwife depends on external praise or lack of criticism of poor practice, or on the profession being seen as universally good, that's an incredibly fragile place to sit. This work needs to be grounded in your own internal integrity, knowing that you are practicing in a way that is ethical, that is evidence-based and centred on consent, regardless of what others are doing, because seeking external approval is a losing game. There is always going to be criticism, especially in a system where harm is occurring on a massive scale. Let's just stop denying it because we know it's true. We've got the massive amounts of evidence to show it. Being able to say, I practice with full informed consent, I respect women's autonomy, I challenge poor practice when I see it, that's a solid ground. And if more midwives felt secure in that, these conversations, these observations, these critiques of care, they wouldn't feel so threatening. And I really feel that instead of asking, why do people criticise midwives?
How dare you?
Maybe the more helpful question is, what is still happening to women that makes this criticism necessary?
That's right. Can I wade in? Can I
Yes,
wade
please
in?
do. Please do.
I don't know if you were going to mention it. It's very poignant that the news came to my ears this morning and at the moment isn't widespread. But there has been a Supreme Court ruling in Australia, the state of Victoria, awarding, honestly, I feel a bit emotional, to be honest, having been one of those women that was coerced into vaginal examinations in a medical setting 36 years ago, almost. And it still brought me to tears. The woman's been awarded £275,000 damages, and her midwives and obstetrician team were accused and found guilty of assault and battery and medical negligence for performing the same thing that my colleagues, I will always call you out, I don't give a fuck, that you've all normalised on these wards, fisting women as part of medical care, even though the evidence continuously shows it has no bearing on length of labour, labour outcomes, etc. You insist on doing it, you coerce it. And that's what they were found guilty of. They coerced a woman into a vaginal exam, even though she'd stated on her birth plan and verbally that she didn't want one. They coerced her into it with all the stuff that you all do. Don't pretend. You can lie to everyone. You can't lie to me. I've fucking worked with you all and I've heard you do it. Okay? So that's why I exist. That bitch that will call it out fearlessly. You all do it, bar a handful of you. You will all lock together and coerce to get a woman to open her knees and allow you to fist her for stupid reasons, for policy, for curiosity, to obey the labour ward coordinator. So you can decide how quickly you press the next coercion. It's not because you've centered the well-being of the woman and the baby. So no matter how people dress it up, I'm speaking to you directly because I've been there and I've watched you and I've seen you. And that's why I knew if I whistle blew whilst I was in the system, all you'd have done is throw me under the fucking bus like you do so many whistleblowers. So I just left you all to it. But the Supreme Court in Victoria have highlighted and ordered the woman to be paid out and named it what it is, assault and battery. Okay, that's what you've all been doing. That's what you've all been normalized. You've normalized, society normalizes it. All the mother-in-laws, all the mothers, all the partners that say you're better off in hospital and sit there whilst you are being violated. It's not just the midwives and obstetricians, it's everyone. I feel very strongly about it. When I read the news, I cried this morning. I actually cried because about fucking time we call things as they are. And I challenge every woman who's been violated by maternity services to bring a case just like this woman did. I commend her.
Yeah.
All of you'll do it. The door is now open. The precedent has been set.
Yeah. It's so important, that case, so important. And I did my class on birthrights because we're recording quite ahead of time, so this will come out well after this has all happened.
An amazing class. Everyone needs to do it. Everyone.
Thank you. But I asked in there, I show an example of an old reel that I have on Instagram, and actually I'll put it back up again, about comparing asking consent for a vaginal examination and what true informed consent of asking about a vaginal examination looks like. And absolutely no one in the lecture had ever heard true informed consent being asked. I've never seen it in 20 years.
Oh. I never saw it, and I was there on the wards listening to these chumps. No.
Yeah. And it's because until coercion, until pressure, until lack of informed consent for procedures is no longer a part of anyone's experience, then calling it out is not the problem. It's part of the solution. So to all of those of you that get butthurt by me putting a wig on and demonstrating the behaviour that's happening on a massive scale, how about you stop attempting to silence the people trying to make a difference, who can speak out, who aren't afraid that they're going to get bullied if they admit the truth, that 92% of people are not being provided with the information they need before making a decision about their care, according to the birthrights document. Stop trying to silence the people who are brave enough to say the things need to change. I cannot express how much the not all midwives line grinds my gears. Until it is no midwives, it is too many, and we should all be speaking up about it, all of us.
And if you can't stop being the problem, you're not even a part of the problem, you are the problem, assaulting women just on the daily, please go and do something else. Please don't be around children and their mothers. Mothers and babies actually would do better. We know from what the US have shown us in their free birth study that they've just 2025 that most mothers and babies would be better off if you weren't there. Just saying. Like, a lot of people say, oh, you can't tell them to go and do another job. What will we do about all these midwives? Have better births, actually.
Birth in peace, the way you want, without all of the interference, without the assault.
Fisted. How about that?
I absolutely love that this woman has won in the court, and I just saw a thing on Instagram that the medics are going to try and fight it, but I just don't see how they've got a leg to stand on. It's very clear that they assaulted that woman. They've breached human rights law, and this is the thing: it's not prioritised in medical care. A lot of people don't realise that what they're doing is assault. They don't realise that they're breaking the law.
They don't realise it. They don't realise it, right? When a quarter of us have been assaulted, right? Anyway, just standard. But you're trying to tell me that the midwives are walking around, they don't think that, oh, well, if you don't open your knees and let me get inside you, they don't think that's assault. Oh, I didn't realise that when she said no and I didn't take her no as no, that I was assaulting her. I didn't realise. Come on.
No, well, I had a midwife get very cross with me recently because she was trying to listen into a baby, and the mum said, not right now, because her labour was very intense, so she didn't want to be prodded in the belly. Yeah. And they were, I need to listen into the baby. And the mum's like, not right now. Oh,
it's my body.
It's really important that we listen in because this is escalating coercion, people. And the mum said no. And after she'd said no 3 times, she tried again. And I said, she said no. Please document that you have offered. She has declined and said no. And the midwife went, yeah, you're getting in the way of me doing my job. Like, I'm the obstructive doula. So your job is not to coerce a woman into compliance. Your job is to offer whatever your nonsense guidance wants to offer. And she has the right to say, yes, please, or no, thank you. And then you write down what she says. You don't then go, oh, it's really dangerous. Oh, you need me to do it. Oh, something bad's going to happen. It's not okay. That's not your job. And if you think that's your job, you shouldn't be doing it.
Please go do something else.
Yes, please stop.
I'm just serious. Please go do something else.
Please.
Away from mothers and babies. Okay. Are we done? Because honestly,
we should stop ranting and do some education, because you can tell we're both mad about this. I think, this passion comes from a place not only of my own having been assaulted in my life. And so I feel strongly about other people not having that experience because it's not fun. It affects you. It affects how you feel for the rest of your life. And women shouldn't be facing that when they're having a baby.
Well, they're the centre of the universe. They're actually repopulating the planet. I thought it doesn't even take, I don't want to assault and batter this woman for us to treat women with respect. It shouldn't take that.
It shouldn't be on the cards, We're here to help women have a wonderful experience birthing their babies.
Yeah.
They should be feeling like the goddess in the room and that we are all in awe of her and what she's doing, because it is miraculous.
Yes,
and
it is.
Instead, women are coming out feeling violated. It's so wrong. It's so wrong. And then when those of us that really care about that and are trying to make a difference are then bullied and attacked online because it's hurt my feelings because I don't do that. Fuck off.
Yeah.
Fuck off. You are assaulting women. Your colleagues are assaulting women. And if you don't think you're doing it and you're getting upset about it, then I think you probably are doing it. Because why would you be being upset about somebody saying women shouldn't be being assaulted? Seriously, you need to look at yourself. Okay, right. We really should stop ranting. Get on with teaching, telling people some useful information. 20
minutes of ranting. but it's epic. This is an epic ruling, and the fact that there are people that want to challenge it, they just need to be crucified. There, I said it.
So I'm not going to promise that this whole episode isn't going to be a rant, really, because it's about cervical sweep. So let's face it. You might need to get yourself a gin and tonic for this one, people, or a big bar of chocolate or something. Okay, so a cervical sweep is often presented as a gentle nudge towards labour, but does it unceremoniously shove you towards labour before you're ready? What does the evidence actually say? Where did this practice come from? And how does it interact with the physiology of labour? Let's begin with what is a membrane sweep. Now, I've got a treat for you all.
Come on. Have you been crafting?
The flaps are back.
flaps.
The
They
flaps
look
are
a
back.
bit flappier than before.
Oh no, it's because it's been sat out waiting for us to record this episode. In fact, these flaps are just pinging open now. Okay, so remember everyone, I'll just hold this up so that you can see that your cervix is inside your vagina. So in order for people to do a cervical sweep, they do have to go all the way inside your vagina up to the top. Okay, so full finger depth in, it's about 10 centimeters. Okay. So a finger is inserted up those approximately 10 centimeters of your vagina. And then if they can, they will poke a finger through the cervix. If they can't, because your cervix is still closed and facing backwards, what they will do is try to, because I'm looking at it backwards around the camera, they try to work it round with their fingers, like try and encourage it to face the exit, basically. Or it makes me want to close my legs together. Just the thought of it makes me want to close my legs together. It's very uncomfortable. And if they can, if your cervix is open enough that they can get a finger through, I've got the help of a scrub. This is your baby's head inside the amniotic sac. It's a scrub mummy. So the amniotic sac is 2 layers, actually. I've got 2 layers with fluid in between. So there's one layer here and then there's another layer here. You'll have to watch us again, those of you that are listening to us, if you want to see my fantastic demonstrations.
You are a genius, seriously.
So these bag of fluid that these 2 bags of fluid that the baby's in, it's actually really adhered around by uterus like this. So it's stuck to the edges. So what they're doing is they're poking their finger in through this cervix and they're trying to separate this membranes away with their finger, sweeping around and separating it away from the edge of the uterus. And doing that creates an inflammatory response, okay, because it's meant to be, there's not meant to be space there. So it sets the body into a bit of a panic, basically, and tries to separate it away. Much like peeling the flesh from a satsuma. Oh, look, I've got a bit of my uterus has come away on my on my finger there. So the inflammatory response has kicked off. And, I've heard that said, if you don't make a woman bleed, you haven't done a good enough sweep. I've heard that said by a midwife to student midwives. Okay. So it's not a pleasant thing. So it's a bit like taking a satsuma, poking a finger in, and then you're shoving their finger around, trying to separate the membranes away, like in a satsuma. So there you go. Oh, that smells lovely. There's no flaps on the satsuma.
Flaps are lower down.
Flaps not included. Can you
went the wrong entrance.
Can you imagine men agreeing to something like this? That someone was going to poke their finger through the eye of their penis and then scrape around to try to create an inflammatory reaction that causes it to swell up and for the structure of the tissue to change.
To help you along.
To help things, it's to force things. And the end of their penis was 10 centimeters inside their body. We have got to start putting up with this crazy shit as women.
Yeah, we must. Come on, women, now. That's it. That's why I say some very horrible, well, not horrible, they're loving, but people receive them really badly when I say, can we just stop being the helpless victim? They did this, they made me do that. Come on, we're bigger than this. We're bigger than this.
Well, I think the thing is that it's helpful to understand this before we get to that late stage of pregnancy, because as we were saying in that last episode, your brain chemistry, the way that your brain is working, your ability to say no is significantly diminished. So you are more manipulatable.
That's why you shouldn't leave your house. And that's why you should only allow people into your house that you trust. But you guys have been fooled into thinking that if you don't allow perfect, malevolent strangers in your house just in case, that you're not safe. But that's why I keep saying, guys, pay attention to what they're learning about free birth, because that's just not the case.
Yeah, Yeah, it's a very convenient thing to say that there isn't, free birth is unsafe. That's perpetuating this myth that medicine makes things so much safer, when actually, when we look at the stats we have, it doesn't. But of course, the numbers are not big enough for them to say that it's significant, because this is the thing. People think, oh yeah, but the what ifs. The what ifs are so rare, or should be so rare, that it takes massive, massive numbers to be able to see the differences in safety. But that's not what we're seeing now. I mean, the stats are crazy. Look at your local trust stats and think, is it really safer?
Trust.
Is it? Yes, exactly. Trust in inverted commas. The intention of this cervical sweep is to force an inflammatory response. So they're basically beating up the lowest part of your uterus, where your baby's sitting, whose job it is to hold your baby in until they're ready. How do you know when they're ready? You will be in labour.
Right.
Not when some obstetrician goes, it's X number of weeks, so your baby's done cooking. They're not. They're not done cooking. With this massive inflammatory response, what it does is release prostaglandins that may or may not cause structural changes that soften the cervix, and they potentially trigger contractions before your body and your baby are ready. So that usually those contractions are discordant and they're not effective, because the rest of the complex and amazing puzzle of childbirth is not ready. How do you know it's not ready? Because you aren't in labour yet. Okay, and then you may get contractions after you've had a sweep, and you might think, oh, I'm in labour. It worked. When actually you aren't. Usually what happens is that you are kept awake and uncomfortable for a few days as a result of them causing an inflammatory response, rather than actually starting labour, because your body and baby are not ready yet. And then they want to do it again. So you get another sweep in a few days' time. Some more disturbed sleep and discomfort in your cervix, which then gets sore. And then they do it again. Yeah. Women commonly report days of discordant and painful contractions that do not change or open the cervix or make minor changes because of the inflammatory response. But because the cervix is just one tiny piece of this complex and amazing puzzle, ramming that one piece does not fix the puzzle, does not make the puzzle. And I'd like to speak about something here that I haven't really heard anyone else talk much about in detail, which is the cervix itself. The cervix is a highly innervated organ, and it is the lowest part of the uterus. And contrary to earlier erroneous beliefs that it was largely insensate, thank you, Alfred Kinsey. Alfred Kinsey, thank you for your reports in the 1950s that perpetuated the bullshit for the next 60 to 70 years. Old Fred and his colleagues decided that the cervix was the most completely insensitive part of the female anatomy.
Oh, fuck you. See the shit. I can't. Oh, I can't. I didn't even know about this.
That's how it was written in the report. And how did they decide it? Well,
they asked their male friends.
They used metal, glass, and cotton-tipped probes. Of course they did. They gently stroked the cervix with the tiny cotton tips and asked women if they felt anything. And much like I suspect in old Fred's sex life, only 5% of women reported any sensation whatsoever.
You're rude. You're very rude. He asked his lovers.
Did you feel anything? Can you feel it yet? No, Fred. Nothing.
Oh God. I need a minute. I don't know why you're so outrageous, but I love it. I love it.
Can't help myself.
Oh God. Mate, your love life isn't researched on it.
What is often left out of the same report was that 84% of women reported when pressure was applied using a larger object. I guess the researchers didn't want people to know that size and what you do with it really does count when it comes to the cervix.
Love it. Love it. Love it. This might be one of my favourite episodes.
The cervix responds primarily to pressure. stretch and distension, so the opening of it. And it contains a really dense network of autonomic, which is sympathetic and parasympathetic nerves. So that's kind of out of our conscious control nervous system. Also sensory nerves that provide sensory information back up to the central nervous system in the brain. And they play a crucial role in sexual function, pain, and childbirth. Okay, but it's taken over 70 years, as recently as the 2000s, and in fact even up to now, for this knowledge to start seeping towards the so-called experts,
Oh,
in inverted commas, of childbirth.
air quotes.
A lot of medical literature still states that the cervix has few nerve endings or is relatively insensitive.
I should check my midwifery textbooks in the UK. I should check what my midwifery textbooks say, because granted they are about 20 years old, but I will have a look and see what they say.
Yeah. The cervix also has vagal afferents. So afferents are nerve fibers that go back up towards the brain. They provide direct connections to the brainstem from the cervix to the brainstem. Direct sensory pathways. You listen to me? Direct sensory pathways from your cervix via the vagus nerve to the base of your brain. And there's even some evidence that nerve density in the cervix may increase before labour, okay, in order to contribute to proprioception. So proprioception is your body's way of telling where bits of your body are in space.
Yeah.
For your brain. So it helps your brain's orientation of where things are. They're important for labour signalling and also the neurohormonal feedback of that oxytocin cycle. And they've shown in animal studies, animals, that cutting the nerve supply to the cervix delays the labour.
Sorry, animals.
So the sensation from the cervix is important for the initiation of labour. And you're accepting the rummaging around in there of that and the inflammation and irritation of it. So you'll be relieved to know that there is some research ongoing now, and it does involve female researchers rather than just male researchers. But yet again, we can see that patriarchal bullshit, that statements are repeated without challenge for tens and tens of years by obstetricians so that they can minimise and belittle women's reports of pain.
Yeah.
You know, they don't offer proper pain relief for IUD insertion, for doing procedures that involve the cervix. And this lack of evidence is treated as a lack of sensation. Women's pain silenced yet again. The cervix is more densely innervated than the main body of the uterus.
Wow.
And the nerve fibers are concentrated in the connective tissue of the cervix, surrounding the blood vessels that are in the cervix and within the muscular layer of the cervix. And as I was saying, its sensation is relayed to the brain via three primary pathways. So the pelvic, the hypogastric, and the vagus nerve. And there is a sensory role in sexual response. So some studies have shown that stimulation of the cervix can trigger orgasms in the right circumstances. And procedures that damage the cervix can cause sexual dysfunction. They reduce lubrication and they can reduce orgasm capacity. So be kind to your cervixes, people, because they're important.
Yeah.
And
gynecology famously just does all sorts to cervices. All sorts of horrible things.
Yeah, because old Fred said you don't feel anything, so they just tell women to shut up, put up and shut up. It's awful.
Fuck off, Fred.
Yeah. Despite massive structural remodelling, so the cervix massively remodels itself as in the lead up to labour and birth starting, the density of nerves in the cervix remains relatively consistent from that point, unlike the body of the uterus, the corpus of the uterus, which becomes actually largely denervated during pregnancy to cope with the stretching as the baby gets bigger. But the women's body's amazing. How cool is that? The body's like, I need to know what's going on with the cervix, because the cervix is really important in holding closed, keeping facing backwards, holding the baby in until it's ready, and then it's got to make all of these massive changes. Whereas this part of the uterus, that needs less nerve fibers because that baby's going to grow and that stretching is going to be uncomfortable if we have innovation from there. So let's switch that off. I mean, how cool is that? Your whole uterus is remodeling and doing all these amazing things. It's just very cool.
cool.
So with pressure and stretch to the cervix, there can be visceral pain felt by women. It can feel diffuse, like you're not quite, hard to localize, quite sure where it is. It can be deep, it can be aching, and it can be overwhelming. Cervical stimulation leads to a deep nervous system activation. You have got a direct line from your cervix to the base of your brain, traveling up via those 3 nerve pathways to the spinal cord, to the brainstem, and to the limbic system in your brain, where emotion and memory are processed. And research has shown that repeated or intense cervical stimulation, sweeping it, can lead to an increased pain response over time.
We are going to need to bring this up again when we're talking about mechanical dilation, ripening agents.
Yeah, so sweeps are often repeated again and again and again to try to affect changes that the body's not ready for. And this can cause what's called central sensitization. So your nervous system becomes more reactive, more sensitive, and you feel more overwhelmed.
Yeah,
Then
makes perfect
your cervix
sense.
has got to try to fully dilate for a whole human to pass through it.
Yep.
So accepting a sweep can literally make your birth more intense, more painful, and more overwhelming. And this has been shown in studies that this central sensitization happens. We also know that pain is increased when something is unexpected, or control is lost, or the body feels threatened. And the cervix is designed to hold your baby in until they are ready. It has an important protective function that we don't yet fully understand, but we know that it is directly tuned in to your brain. And a sweep is a massive insult to what the cervix is trying to do, because it's not ready yet. Otherwise, it will be doing what it's meant to be doing. What it's meant to be doing is holding your baby in until it is ready. So if you're going in there sweeping around, you are directly impacting the autonomic nervous system, the fight, flight, freeze, fawn response. You are introducing a sudden or unexpected stimulation, and women often will try to pull away, will panic, will freeze, will feel violated. And these feelings obviously can interact with stored previous memory. And we need to understand that a significant proportion, as we were speaking about earlier, of the female population have been assaulted. So if you're told something like, oh, it might just be a bit uncomfortable, and then for you experience it as intense, invasive, and painful, that creates this cognitive dissonance, which can amplify distress because the expectation of what it's going to feel like does not match what is felt. So please be really mindful that many women do experience sweeps as very painful and invasive. Many just put up with it because they think it's necessary or helpful or a good idea. But is it? Is it a good idea? For the vast majority of people, no. It's really not. And like many obstetric interventions, membrane sweeping doesn't have a clear single origin moment that I can find. It appears in obstetric texts from the late 19th and early 20th centuries as a mechanical method of, and I'm putting this in air quotes, encouraging, but let's call it what it is, attempting to force labour before the body and baby are ready. How do we know when they're ready? You'll be in labour with no need for forcing it. Earlier midwifery texts describe cervical stimulation and manual techniques, but often with a huge amount of caution. Historically, obviously, there was significant concern about infection before antiseptic practice was standardized. There was also concern about premature interference with pregnancy. Okay.
Yeah, we used to care about that once.
Yeah, exactly. This is the thing. We used to care about these things, but now we've got antibiotics. It's like, oh, well, we can give someone an infection. We can give them sepsis because we can treat it. Why do we want to give them sepsis? Or we can make a baby come out early before they're ready because we've got neonatal intensive care. But why do we want to? And remember that your due date is a guess. So a lot of the babies in the NICU are there because women have been told by their obstetricians, your X number of weeks, your baby's ready. They're outstaying their welcome. They should come out. Let's force them out. But they're coming out before they're ready. And you've accepted this train of intervention that is induction of labour. Your baby wasn't ready for the stress of a physiological labour, let alone an induced one. And so they suffer. Just because we have the ability to care for babies born before they're ready, does that really mean that we should be forcing them out before they're ready? You got to think about this. This is your decision, your responsibility to decide what feels right for you. A study by Berger et al. That has been recently released found that babies who were induced at every week between 37 to 41 weeks So did you hear that? Every week between 37 to 41 weeks had lower educational attainment at age 25. The week of gestation is irrelevant. Your baby isn't ready to be born until they are ready. And if a doctor is telling you that they are wrong. And they are not providing you with up-to-date evidence-based information if they are not informing you that an induction will impair the function of your child's brain for the rest of their life. It's not informed consent.
Was that the Darlin research?
No, it's a recent paper that's come out by Berger. It's just come out. Yeah.
My God, I have not seen it yet. Okay.
Yeah, I'll send you. I'll send you it for anybody who's interested in joining us as an untethered rebel. It will be in the notes that accompany the show. A link to that paper. Okay, it's really important work. So it carries on from what Hannah Dahlen showed that it affects, and what they've seen is that the difference is at every single week of gestation. So it's not just if it's early; it's if you are interrupting, at any week because the baby's not ready. It
makes perfect sense. And you know me, as everyone knows me, it's like, fuck research. A lot of it is skewed. Really grateful that research was done.
Yeah. By the mid to late 20th century, as hospital birth became the norm and induction methods were developed, membrane sweeping sort of gained this popularity as a, in inverted commas, less invasive alternative to pharmaceutical induction. I don't think it's less invasive having some fingers in your uterus, but hey, it's basically perceived as the lesser of evils.
In your uterus.
Well, it is in your uterus, isn't it?
In your uterus. Okay, yeah.
Yeah, this is the thing. This is what I was thinking about it. I think people think about it. They're just like, oh, yeah, it's just a sweep. But it's in your uterus someone's rummaging around.
100%.
But, and induction is really shit for most people. So sweeps are probably slightly less shit, but they're also less effective form of induction. Why not just not have any form of induction at all? Why not just wait until your baby's ready? Your body, as Kemi says so beautifully, has grown a whole baby up to now. They've, made eyelashes.
Seriously?
They've made all their cute little fingers and toes.
The tiny little fingernails.
Oh, why do you suddenly think that it doesn't know what it's doing? That your body suddenly lost the plot?
It's so rude. And of course, just watch one of those silly cascades, this influencer, great hair, beautiful makeup. Oh, I don't want an induction, so I'm having a series of sweeps. And then it goes really silent. And then she's showing you her emergency cesarean scar. Like, she's missed out a huge chunk of her journey. And then she just then one of her reels is like, how to massage your cesarean scar to reduce adhesions. I went, right, of course. Because it cascades, because it's rubbish. But more importantly is how disrespectful of yourself, your baby, and your process. You've got all of this lovely kit in the baby's nursery, but you didn't take 5 minutes to find out that a membrane sweep is an induction. Yeah. And it cascades in the same way as other induction methods do.
Yeah, and just to be clear, if your care providers are not telling you that this is what a sweep is, that is a form of induction, that it has these consequences to your baby's brain for the rest of their life, they're not giving you informed consent, so they're assaulting you.
Battery, again.
Yeah.
And medical negligence, because we're supposed to be able to support our recommendations with good evidence and birth physiology. So it's medical negligence if we haven't.
In the more recent decades, sweeps have been incorporated into guidelines as a way to potentially reduce the need for formal induction, as they say, particularly post-dates, because they want to meddle with everyone earlier and earlier. How about we just stop fucking messing with people with inductions? That'd work.
We're just making ourselves look stupid. Just saying, as midwives and obstetricians, we're actually making ourselves look like the dim, meddling, malevolent criminals that we are at the moment.
In modern maternity care, membrane sweeps are now often offered from around 38 to 40 weeks onwards.
Recommended in the NICE guidance,
in
folks,
the NICE guidance,
supposed to be experts, a bunch of experts apparently.
Yeah. To reduce the likelihood of going significantly overdue for a potential very tiny reduction in the very tiny chance of stillbirth, in order to lower rates of pharmacological induction like prostaglandin gels or oxytocin drips, to offer something seen as low intervention compared to a medical induction. But there's also the psychological component here that sweeps are often framed as something you can try before we move to stronger methods. And that framing can make it feel like it's a middle ground, a compromise between waiting and induction. And that plays into that action bias that we've spoken about before. Surely doing something's better than waiting. No. In the vast majority of cases, it is not. It's not making it better. Okay. So they're trying to stimulate prostaglandin release, irritate the cervix, potentially trigger uterine activity. But labour is not just about prostaglandins or cervical readiness. No. It's a whole body process, including the hormonal orchestration of oxytocin, endorphins, catecholamines, fetal positioning and their movement, uterine
sensitivity of oxytocin receptors.
Yeah, uterine muscle coordination so that the whole uterus contracts in an effective wave, the nervous system regulation and psychological safety for mother and for the baby. And a membrane cervix focused. It doesn't align the baby. It doesn't regulate your hormonal cascade holistically. Right. And it doesn't create a neurohormonal environment that's associated with spontaneous labour onset. And then that continuation of that perfect neurohormonal environment that helps breastfeeding and bonding and the enjoyment of parenthood and the proper development of your child's brain and their body. And also your development as a mother. The evidence base is mixed regarding cervical sweeps, but relatively consistent in direction. And I might add as well that the usual spin on the wording in favour of intervention is rife. It's rife. It's so funny. They say things, so including in the Cochrane data, they suggest membrane sweeping may reduce the likelihood of pregnancy continuing beyond 41 to 42 weeks, which means it may not. More likely, it doesn't.
Yeah, that's right. It says May. And also, I remember when I read that was 2021, wasn't it? About sweeps. And they casually don't mention, well, actually, they do bring it in the end, how the pregnancy is ended. So, yes, the pregnancy is ended, but how?
Yeah, but was it on a physiological birth? No. It may slightly reduce the need for formal induction. Again, it may, and more likely, does not do that.
Yeah.
It does not reliably trigger immediate labour. Well, at least they're honest with that one.
Yeah, they are. Yeah. Because it's only it's 1 in 8 times, isn't it?
So it increases the chance of labour starting at some point in the following days, but by a very small amount, basically. So for many women, nothing happens. For more women, there is a lot of discomfort and disruption and cramping and loss of sleep and undermining of confidence that their body's broken and it's not working. So for every 10 women having a sweep, 7 will be likely to go into labour within 2 weeks.
Stop lying. Everyone knows that the chances are that someone's going to cough their baby out within 2 weeks.
Yeah, compared to 6 if you don't have a sweep. So it's 7 out of 10 will go into labour within 2 weeks with a sweep, with all the disruption and the lack of sleep and the cramping and the feeling like your body's not working, compared to 6 who will go into labour within 2 weeks without sweeps, who are actually going into labour when their body and baby are ready, so that their baby's brain is functioning well for the rest of their life.
Yeah.
Yeah, and that was from the Cochrane review of sweeps at 40 to 41 weeks. So is it worth it, really? I mean, really? If you're about to go into labour anyway.
My mother-in-law's flown in, especially for the birth or to look after my other child. So, yeah, it's worth me, affecting my child's ability to develop cognitively for up until well into their adult years. Yeah, it's worth it. So I've got my mother-in-law there because she wants to be there to help.
Yeah, well, you're going to need her help because remember, if you're choosing to step onto that induction train, This is your first baby. Your chance of your birth then ending in a cesarean is 50 to 70%. And if it's a subsequent birth, it's 25 to 30%. Whereas with spontaneous labour, the chance should be no more than 15, but with skilled pregnancy and birth support, more likely to be around 3 to 10%. The farm have had caesarean rate below 3% since the 1960s, so midwifery-led care at the farm since the 1960s. Have the women accessing the farm got older and fatter and more complex and meant that their caesarean rate is justifiably now 50% plus? No. It's still below 3%. Okay, so you just all need to stop accepting the current maternity madness that means that if you choose to step foot onto an obstetric ward, that your chances of ending up with an induction, augmentation, caesarean or instrumental birth are 30, 40, 50, 70% plus in some places. It is literally insane. Please stop loading yourselves onto the conveyor belt for slaughter. Please. It's also important to say here that please understand that a sweep and any subsequent forms of induction are likely to be less effective and more invasive if you are having them at an earlier gestation. Okay, remember your gestation is a guess, but the earlier that you are going in that guess window, the more likely your cervix is going to be posterior, the more likely your cervix is going to be more closed, and everything in your body is less ready for birth, including your baby. Yeah, so the ratio of damage is going to be higher for you both. Okay. What do women report experiencing? So commonly reported experiences of a sweep include pain or significant discomfort during the procedure, cramping afterwards, bleeding or spotting, irregular contractions that do not progress into labour. Qualitative research and surveys show mixed feelings about it. So some women feel reassured that they are doing something, in inverted commas. I hope that this podcast helps you to realise that doing something is not better than doing nothing. I really hope that it helps you realise that. Others feel the procedure was more invasive or painful than they expected. Some report not fully understanding what would happen beforehand, and that's very common, that the whole procedure and what is going to happen to you is not explained well. So hopefully this explanation today has helped you realise that. There is also a notable proportion who experience several days of stop-start contractions without established labour, emotional fatigue from repeated sweeps. And I'd also like for people to consider the baby in the process as well. I know they aren't really considered in these procedures, but please do. The protocol is to listen in to a baby before a vaginal examination and a sweep, and then to listen in again after. Why are they doing that then, if it doesn't affect the baby? They wouldn't be doing that if there wasn't an effect on the baby, would they? And I've heard midwives say, oh, just a little tickle on baby's head. Oh, it gives me the ick. Just tickle baby. Their heart rate's racing because I just tickled them. No, you poked the baby in the head. You didn't tickle them, and they've never been touched before. And you startled them, and you frightened them. And so their heart rate sped up as a shock response. It's a frightened response. And I've seen babies move away from the prodding of cervical sweeping and get themselves stuck in awkward positions that then made the labour and birth very difficult. Baby, I had it once where a baby got so wedged, I was trying to do biomechanics and the midwives was shouting at her to push even when I had her upside down to try to back the baby up to get enough space.
Why would she push then, idiot?
I know.
But, I'm abusive. I know you guys get upset. So, she says fuck and she called us an idiot. You got to stop your shit. You're looking stupid. You are bringing midwifery into disrepute. I have to distance myself from you guys. You're making it look stupid. Just want to also add, because it comes up so often in conversation, and I'm really glad you've mentioned the agitation that happens, so everyone thinks, someone poked away at my uterus. Someone entered my uterus, caused inflammation, and now my uterus is responding, oh, am I going into labour? This is exciting. No, you're just agitated. It's what your body's supposed to do, right? It's an inflammatory response. Also, some people, they have some stranger poking their uterus out, basically, And then they get excited because you lost a mucus plug. Of course you would, because they've dislodged it when they were fidgeting around in there. Please don't say, "Oh, does that mean something's happening?" No, they dislodged the mucus plug, and
Just scraped their finger around and pulled it out. That's what's happened.
That's all that's happened. This is not progress. And also, your mucus plug, just like if you've got one of those snotty colds and you blow your nose, 2 minutes later your nose is blocked again. It's the same with the mucus plug. It will reform. So this is not progress. So just need to just stop lying to yourselves that accepting this membrane sweep was a good idea. Just stop
and
it.
it's reforming because it's needed. That mucus plug is there to try to stop infection going into your uterus.
Thank you.
But what you're having is somebody poke their finger and bypass those safety mechanisms that your body has to try to prevent an infection coming up into your uterus. What the midwives of older days warned against: do not meddle with cervixes, do not meddle with vaginas, because you are going to cause an infection. And be mindful that, yes, we have antibiotics, but bugs are becoming more antibiotic resistant because we're using them too much. We should not be doing things that we know cause infection.
Because then the mother and the baby then have the side effects of antibiotics.
Yeah. You've got the health implications for that. Yeah.
Yeah, you've got the health implications, your immune system response, gut health, brain health. That's why you're not blameless, midwives, when you say, "Oh, well, shall we just do a series of sweeps then so you don't have to have an induction?" That's a lie. That's a con. You're duping women into things that will affect them and their baby's health ongoing.
It's a form of coercion to make you feel more comfortable as a midwife, because you'd rather not see somebody go through a formal induction, a medical induction. So you say, let's have a sweep instead. That it's just a form of coercion to make yourself feel more comfortable. You know that it's not good for a mother and baby to have an induction.
That's why I call you a lot of deceptive criminals. That's why I use these terms.
You also need to know that a sweep has the same implications, really. And
but
people just end up on the train.
But you should know that, because it's your job. When we on the register of the Nursing and Midwifery Council, the NMC codes say that we're supposed to understand the implications of all of our offers, including the latest research, the stats. That's our job. We're failing.
And though there isn't actually, I couldn't find any research about whether sweeps mean that babies are more likely to be malpositioned. I would say, in my experience, that the babies I've seen most malpositioned have been after unconsented sweeps, where a woman's consented to a vaginal exam and an unconsented sweep has happened. And at one time where a woman consented to a vaginal examination and then the midwife did an unconsented ARM and the baby got stuck and they had to have forceps.
Yeah.
Though that hasn't been studied, that's what I've seen.
Can I qualify what you're saying, Shellie? Because absolutely it makes sense from a birth physiology perspective. Please don't think that you need to qualify everything with evidence. As I've said, evidence never used to involve women anyway. It was always men, right? And it's only a recent development of obstetrics, including evidence. So you don't need to supply a bit of evidence to show that poking a baby in the head when they've never felt somebody poking them in the head before isn't going to cause them to move their head, potentially out of a flexed position.
Yeah, it does happen. So please be very clear, if you're consenting to a vaginal examination, what you do and do not consent to. Say, I do not consent to a sweep. I just want to be really clear that you must not do a sweep if you're accepting that. You must not do an artificial rupture of membranes. And remember that you can remove your consent at any time, and that person should immediately remove their hands from your body. It is not okay for a medical professional to say, I'm just going to leave my hand in for a moment. I'll hold it still. It is assault. If you have removed your consent, if a man had his penis inside you and you told him to stop and he said, I'll just hold it still for a minute.
Hold it still.
Not okay. Stop believing it's okay because the person has a white coat or a title or
scrubs or a name badge.
Yeah, or is trying to belittle you as if they know better. Like, I don't want to increase the infection risk by going out and coming back in again. Well, you shouldn't have increased the infection risk by putting your fucking hand in there in the first place. There you go.
Yeah, there you go. Are you getting it yet, guys? Because honestly, I know we sound repetitive, but I think we have to, because today, as I said, we've got the news that a woman's received quite a lot of money, which doesn't equate to her distress. I'm telling you, she should be paid like 4 times more at least. But she's received a few £100,000 um, because she was assaulted and battered, and her team were medically negligent. I personally would prefer to not suffer and not be assaulted and battered. The hundreds of thousands is nowhere near enough for the harm that they caused by doing that. And it's really time now. We've got a bit more to say. Like, did you mention the 1 in 10 that would suffer artificial rupture of membranes because of the membrane sweep? Have we mentioned that?
No.
Yeah. So
that then puts you on the train of infection. We want to.
If you, well, I
augment your
suppose if
labour.
you've opened your knees and let them do a membrane sweep, then yes, you probably are more psychologically vulnerable to letting them do the rest. Because yes, they say it puts you on the train, but does it? Yeah. What train? Is it the train of death? No, it's an infection train for the baby. And guess what? They'll just wave around their antibiotics like they do for every other reason, right? So we've got to check what trains you are consenting to getting on. And it's not just you loading your child on there, it's yourself on there, you're loading your baby on there too. This is a responsibility issue. Very uncomfortable conversation, but we are not helpless victims. We've got computers in the palm of our hands that we probably spent an inordinate amount of time scrolling on. You can find out what you're saying yes to.
Yeah. Yeah, you can get the information, because membrane sweeps are, they're generally considered low risk by medical professionals, but they're not risk-free. And I wouldn't consider them low risk, because I would consider the physiology they're disrupting and how that delicate balance can be completely thrown off track with significant consequences, like we've explored in that paper today, the impaired academic ability measured up to 25 years. That doesn't sound like a low risk to me. That sounds fucking important.
Yes.
Yeah, so never mind the risks that you might be told, like pain, discomfort, bleeding, accidental rupture of membranes, like Kemi's just said, and 1 in 10, infection, with repeated vaginal examinations, repeatedly going into your cervix, irregular contractions without labour progression, emotional distress or feeling pressured. You're beginning a process that your body and your baby are not ready for. So you are disrupting the important safety mechanisms that we have spoken about in season 1 to keep you and your baby safe through labour, birth, and then beyond into breastfeeding, bonding, and out of womb development. Yeah. It often doesn't work. They've created a pathway for you towards further intervention. Yeah. Does it prevent induction? Further induction than the mechanical induction you've always had? No, it doesn't. Firstly, because it is an form of induction. So there you go. It doesn't prevent induction because you just had one. Okay. So, and what the evidence shows is it does make a modest, what they call in a modest reduction in formal inductions, but not an elimination of it. So it can shift the probability slightly, but it does not guarantee outcomes. It's a mechanical attempt to initiate a biochemical process, but it doesn't engage the full system that coordinates labour. And that's why it's variable. That's why the results are variable.
So does it reduce cesareans, for instance? You know how the inductions cascade to cesareans, etc. This form of induction, does it reduce the cascade to cesareans?
No. So the Cochrane review on membrane sweeping for induction of labour, which had 44 RCTs, 6,940 women. Membrane sweeping increases the likelihood of spontaneous labour onset, but we've already heard how little it does that within 2 weeks. Reduces the need for formal induction. Well, was there really a need in the first place? Go back and listen to our episode of when induction actually improves your outcomes. So no, probably not. There is no clear difference in caesarean rates, instrumental birth, maternal or neonatal serious outcomes. And an important nuance of this is that the evidence quality was of low certainty. So no, it does not clearly improve the hard outcomes of vaginal birth rates.
There you go. Hence why I've never done a membrane sweep.
Yeah. It's pointless. It's a pointless, uncomfortable, potentially traumatizing waste of time. And if we look at, there are 3 studies that about women's experience of this, three studies. Okay.
Because they
And
really care.
What's interesting is that the majority reported a positive overall, but despite the discomfort. But that's because our culture is based upon this premise that babies apparently need to be evicted by any means necessary at arbitrary dates that are a guess. So, no. The earlier Cochrane systematic review data by Boulvain et al., they found that the number needed to treat was 7 in order to avoid 1 formal induction, compared to 6, as we said before, needed to treat in order to not have a formal induction. So, the benefits are modest, and that's being kind. And it must be, and they said in the conclusion, must be balanced against side effects and discomfort. Is it that important for you to end your pregnancy early that your baby will be less smart for the rest of their life? Will it? Not for me. No.
Me.
You intervene in 7 women and it avoids 1 induction. How about we just don't intervene and avoid all the unnecessary inductions? Do you know what, Kemi? I think you and I would be a far more effective intervention for avoiding formal induction. Never mind sweeps. People could just have a chat with us. We'll help you. With the only side effect being that you'll remain pregnant until your body and baby are ready, unless there's something else comes up that makes you feel that it is a better decision.
Yeah, exactly. These things aren't rooted in stone. We're not the anti-intervention no matter what queens. We're just asking you to think, engage the brain.
Yeah, please ask the question, is this induction necessary? Is my or my baby's life in danger?
Yeah.
Does the evidence show that if I have an induction that it will improve my outcomes in this situation? And the answer is usually no. Do you want to have an induction? Do you know that you don't have to have an induction? You really can say no. And you shouldn't be being pressured at every appointment from booking until your baby is out that you should have one, because that is obstetric violence. It's coercion.
Yeah.
Okay?
Ratified by nice guidance who recommend that.
Babies aren't late. They're like wizards. They arrive precisely when they mean to. Yeah. There's more evidence showing basically all the same thing, that it doesn't start labour. It's not a reliable trigger for labour. That there's a slight increase in birth, but not much. It doesn't strongly change birth outcomes. There was an RCT in 2022 around the frequency of membrane sweeping. And they found that if you have them twice weekly, it might reduce prolonged pregnancy. Again, in that small amount compared to not having them.
Pregnancy is not an illness.
Exactly.
It's not something that needs fixing.
And of course, they found more frequent sweeps had more of an effect. The more you cause an inflammatory reaction in your body, the more changes that happen in the cervix, but it's dose dependent. So do you really want to be rummaged around in a lot? Or not?
Just because they can doesn't mean they should.
There is no consistent increase in immediate labour onset. That's from a recent RCT. Side effects, pain, bleeding. Helps, they put in inverted commas, prepare the cervix more than it helps to trigger labour. Your cervix doesn't need preparing. It can do the preparing itself.
Thank you. Okay. Just like it grew a whole human.
Yeah.
Just like you grew a whole human.
Doesn't need prodding. You can
prepare your own cervix.
What happens, as we're saying, it's increasing local prostaglandins, it's increasing local phospholipase A2, and it's increasing local oxytocin activity in the immediate vicinity of where you're creating these things. But they are local biochemical effects. Yeah, it's not guaranteed that then you're going to get a coordinated labour cascade into proper physiological labour. There is no consistent improvements in outcomes like vaginal birth. So if they're telling you, if we give you the sweep now, it will make it more likely that you'll have a vaginal birth, that's not true. That's not what the
No.
evidence shows.
No.
Okay, that's really important, because I think people think that if I have a sweep now, I'm more likely to have a vaginal birth, and that's not true. That's not
No.
what it shows. And women are willing to repeat them despite the discomfort because they've been groomed to think that they need to accept them. You don't. You don't. And from real world accounts, the qualitative insight into it, you know, people say things like, it was honestly unbearable. It didn't trigger labour. I had 5 and I was still induced at 42 weeks. I had mild cramps, spotting, nothing happened. This one worked within hours, but I was already dilated. So it didn't work. She was just about to have a baby and she got rummaged around in, and then she thought that the sweep worked when actually she was just going into labour.
Embarrassing.
Oh my goodness. You know, and the long-term outcomes are not really established because they don't care what happens to you and your baby in the long term.
That gets kicked down the road to paediatrics.
It's really important. Sweeps do not reliably trigger immediate labour. They do not improve your birth outcomes, reduce your caesarean section likelihood, reduce your induction very slightly, but not much, and you've already had an induction because you've had a sweep, so they don't. And they don't improve your vaginal birth rates. And they do not ensure that a physiological labour cascade is going to happen, because it's not physiological to be rummaged around in. The choice is yours. The choice is yours, people.
Are we done?
We're done. Choose wisely.
Yeah, because...
Please choose wisely. Okay?
Yeah.
The choice is
Please.
yours. Okay? And if your care provider is pressuring you to have a sweep, that's assault.
Yeah. Take
It's against human rights law. It is assault. And I think we just need to be a bit more blunt with people so that they realise that it's the truth.
Yeah.
So please feel free to be blunt and say, no, I'm not accepting that. Please document it. Do not speak to me about it again. Put that in my notes, and I will consider it harassment if you do. Yeah. Hope that helps, everybody. We'll see you next time.
Take care.
Bye-bye.
You can sign up to the Birth Untethered mailing list from the link in the show notes, become an Untethered Rebel, support the show, and join the growing community that meet together online each month to share collective wisdom, support one another, and also to receive extra resources that supplement podcast episodes.
The information shared in this podcast is for educational and informational purposes only and should not be construed as medical advice. The views and opinions expressed by guests are their own and may not reflect those of the hosts. This content does not replace professional